Hello, welcome back to our channel. I am Dr. Ivan Arinaitwe, a public health specialist and a digital physician working with my Musawo. So today's video is about pediatric and adolescent HIV care and management. This is a type of care that focuses on children from 0 days to 19 years old and that are exposed, affected and infected with HIV. In pediatric HIV care and management, 0 days simply means that it is the mother that is infected with HIV. Therefore, we are looking at birth of an exposed infant. You might have heard people say he or she was born with HIV, so care and management of these infants in this category is different from those that get infected later on in life. So the core management for infants who are in this category is simple. We do give them HIV ARVs as an early age of 6 weeks onwards, because that's where we start testing them from. So the management of such an infant is that we shall do blood samples, what we call a DNA PCR, at about 4 to 6 weeks after birth. And then if a result comes back that it is positive, we will start them on ARVs. If it is negative, they continue on septrin prophylaxis for until 9 months. At 9 months, we repeat our DNA PCR. Depending on the result, we'll either do a third one 6 weeks after breastfeeding, or we shall start them on ARVs in case it is positive. If all that is negative, and even the one at 6 weeks after breastfeeding is negative, we will do an antibody antigen test at 18 months and thereafter discharge them as infants who are HIV negative. So the terms infected and affected are very commonly misused. Infected means that particularly an individual has HIV depending on their age band, while affected means that they don't have HIV but they are being taken care of by an HIV caregiver, or they lost their parents or guardians to HIV. This category of children requires a different management approach to those born with HIV. So when we talk about children that are affected with HIV and we want to manage them, it is as though you have affected, as we said earlier, it is as though you have someone taking care of you that is HIV positive, but because of that HIV positivity, they are limited in other areas. So that child is suffering, or maybe may not get full progress in terms of development and care because they are affected in such a way. So how do we manage them? Along the way with Ministry of Health, we have had very many implementing partners, of course with funding from CDC, PEPFAR and USAID, that have come in to partner and have some groups, or can I call them categories of individuals that are being taken care of. In this, we have what we call the orphans and vulnerable children, which we call OVC care. So in this is that when you are affected with HIV, that is through your parents, as we know most of them, most probably because of HIV stigma, don't have work, or they don't earn something as others. You will find that we are enrolling these children and adolescents to the OVC program. And in so doing, they are able to get these categories of services. They are getting school fees to go to schools. They are getting basic needs in terms of books, pens, soap, mention it. But on top of that, they are also getting life skills. Life skills both to them, the children that are affected, but also to their parents that have the HIV. And with the life skills like sewing, making liquid soap, making some forms of charcoal, this has helped them gain some money in terms of income generating activities. And that is how they have survived all through this. In so to say simply that is way of one line that we can give. And when this child is above their age of about 18, they can actually take care of themselves and also the parent that was taking care of them. So, it is important because the current Ugandan population is mostly made up of the youth, but also because children 0 to 9 years depend on their caregivers for adherence and viral load suppression. So it is, if the parents don't understand how to take care of them, it can put them at more risk. It is also particularly important for the age bracket between 10 to 14-year-olds, because this is when most children start to gain a bit of independence. Also, this is the time they are around high school and boarding schools. And for children between the age group of 15 to 19 years, they tend to have a bit of an ego. They start to feel capable of taking care of themselves. However, this is the time most people start engaging into sexual activity. And it's here where the spread is most rampant, because there is urge coupled with naivety and ignorance. In Uganda, the Ministry of Health through AIDS Control Program has put up a Pediatric and Adolescent unit to oversee the program implementation in the country. This works with the regional implementing partners that are closer to the health facilities to oversee the work. Well, we have done very, very well with elimination of mother-to-child transmission as a country, which has been championed by the First Lady. And we are doing the best to improve the 95-95-95 cascade. So the 95-95-95 cascade was put up by UNAIDS to help countries struggling with HIV try to track their progress in the fight against HIV. The first 95 means that 95% of the population that has HIV knows their HIV status. The second 95, of those that know their status, HIV status, 95% of them are put onto treatment. And the third 95 just means that of those that have been put on treatment, 95% of them have a viral load suppressed. But also not only viral load suppression, they are retained into care. If I start with the children and adolescents themselves, as a country program, we are trying to make sure that the adolescents take care of themselves. So we have put up self-care models that are trying to adjust the lives of adolescents, and they own their care and treatment plus management. We believe that through this, they will be very able to initiate their fellows and try to make sure that they stay in care, but also empower themselves to take control of their age. With the ones that are 0 to 9 years that are still dependent a lot to their caregivers. Continue to sensitize the parents. We have gone ahead to make treatment literacy materials that are more on brochures and posters and videos that we are going to share at every HIV clinic and educate the parents and caregivers such that they try to understand the importance of taking good care of someone who is on treatment at that age. But also we are not forgetting the line ministries, not only Ministry of Health. We have brought on board the Ministry of Education that we shall work with the schools, the school nurses, the head teachers and stakeholders in schools to make sure that the help we need, the message we want to transfer to them, because most of these 10 to 19 are in boarding schools, but also the ones that are 0 to 9 have started going into schools, boarding schools. So they will end up being taken care of from there. We have also had Ministry of Gender and Labor put on board, plus the Ministry of Justice. All these to package something that can come out to try and work favorably for the child and the adolescent.
Well guys, our battery went off just like that. However, thanks for watching. Don't forget to comment below, hit our like button, and most importantly, subscribe to our channel.